Hello everyone, today we are going to talk about fasting blood sugars. So the question is, what should my fasting blood sugar be? And that question comes from patients with pre-diabetes and patients with diabetes on medications or without medications. So I am Dr. Ahmet Ergin. I am the founder of SugarMDs.com. I have been an endocrinologist for more than 6 years, seeing a lot of patients in my diabetes practice. And I am giving a lot of importance to educating patients, making them understand what diabetes is all about and how to overcome the challenges that you face on a day-to-day basis. Now, number one question that everybody needs to understand: what is fasting blood sugars? What should your goal be? Now, the goal is different for everybody. Now, overall, if you want to understand the numbers and if you want to get your hemoglobin A1C down, then you should understand this. Your blood sugar has to be at least less than 130 before any meal. That includes fasting. And your blood sugar should not be more than 180 2 hours after any meal. If you can achieve that, your A1C will be less than 7%. And most of the time, doctor will tell you, oh, we're gonna get your A1C less than 7, but doesn't tell how, right? So you need to understand your numbers so you can set goals, right? And then if your numbers are not at goal, you should be accountable. So at SugarMDs.com, we get a blood sugar of 200 from you. We text you, hey, what happened? Did you have something extra? Did you forget to take medication? You know, this is not to pressure you, but to keep you accountable. So until you get it right, we will be on top of you guys. Sorry about that. Okay, so let's say the fasting blood sugar for someone with A1C of 7.5, or somebody who just got diagnosed with diabetes at 6.8% A1C. Now, it's easier to get the fasting blood sugar as low as possible. So if you're a normal individual with no diabetes, we expect it to be less than 90. But when you have pre-diabetes, your blood sugars start to go about 100 and it becomes 100 to 126. So that's the range that most pre-diabetics live in. So we tell them, the lower the better. So if your blood sugar is 120 in the mornings, we can actually get that down. So if you exercise a little bit more, eat a little bit better, next thing you know, your blood sugar may come down to 90, and that's how you prevent going to diabetes, which we talked in the last video. Now, also, if your blood sugar is running at 300s, I don't expect you to bring your blood sugar to 90, right? So we have to make a gradual plan so that we can get your blood sugar down in a safe way. So why do I safe way? Because sometimes, that includes doctors and patients, they get obsessed with their fasting blood sugars and they put very aggressive goals to get their blood sugar down, and they start giving a bunch of medications, pills, insulin, throw medications all around to get the fasting blood sugar down. Now, when you try to do that, your blood sugar may drop so low that before you see the morning, you may wake up with a 30-40 blood sugar, shaking, sweating like you're gonna die in the middle of the night. You don't want that. You want to bring the blood sugars down in a safe manner. Because there's so many ways to bring the blood sugar down, but the initial goal, if you're running at 300, it is better to be less than 140, 130 at first, and then reassess, and then see if it can get you down even better. As I said, if you are less than 130 fasting, your A1C will be more than likely at less than 7, but sometimes our goal for A1C is less than 6.5 or even lower. Again, that depends on the patient, depends on the age, diabetes status, other diseases, all sorts of things that we factor into. So as a result, as I said, the gold standard is less than 130, but if we can get you less than 100, we will. And again, that has to be done safely, that has to be done without causing weight gain, that has to be done without causing low blood sugar. So I hope that video helps, and we will continue to talk about diabetes. So tune in for the next video. And this is SugarMDs.com, Dr. Ahmet Ergin. Have a great day.